Hey Savvy Social Workers, so in this video I am going to take you through a sample question from each of the units that you will see on the ASWB exam, just to give you an idea of how to answer the questions that they give you, or more so how to identify the type of question that you're answering, because again, you do have to understand that you answer the questions from the different units in different ways. Okay, so you won't answer a unit 1 question like you answer a unit 3 question. You won't answer a unit 2 question like you answer a unit 4 question. The same thing I teach in, when I say you can't answer a first question like you answer a next question, it also matters the unit. So being able to identify the unit where the question comes from, it also helps a great deal in helping you to understand what the question is asking and how you should be approaching it for an answer. So that's what we're going to get into today. Again, be sure to read my disclaimer at the top of this video. Let's get into it. A school social worker is consulting with the teacher of a 7-year-old boy who has behavioral issues in her class. The teacher reports that the boy constantly looks for ways to annoy other students in the class, such as pulling at the girl's hair and hitting the boys in the back of their heads. The social worker tells the teacher to allow the other students to do the same thing back to him when he does this, which is most likely the type of intervention that the social worker is proposing. Okay, so this is, of course, a most question. And so when we have a most question, it just simply means what makes the most sense. That's the way I simplify it in my mind. So we're looking for, first of all, what is the priority problem here in the unit 1 questions. If it's not like first or next, then I don't really bother with kind of going through the savvy strategy that I teach, because I know that it's really most of the time not even necessary to do that with unit 1 questions, especially if it's not a first or next question. Most of the a lot of the unit 1 questions will be like your most questions. Okay, so again, most, we're looking for what makes the most sense for the priority problem. In this case, we have a 7-year-old boy. Of course, when it's human behavior or human development, anything like that, I always pay attention to the age or the stage that's presented in the scenario. So we have a 7-year-old boy. He has behavioral issues in this teacher's class. So human behavior, that's a good indication that that's where this question is coming from. So the teacher reports all of this, which is what I am not going to read through. So this is what's going on. So my priority is this, though, is that the social worker tells the teacher, her response to the teacher, to allow the other students to do the same thing back to him. That is the priority that I need to be focusing on, because the question wants to know which is most likely the type of intervention that the social worker is proposing. So that means I have to look at what the social worker is proposing and address that. In this situation, the social worker is proposing that the teacher allow the other students to basically, pull their hair, pull back on him or hit him back in the back of his head. So the question wants you to identify what type of intervention is this, okay? Is that aversion therapy? You have to know what aversion therapy is. So for this one, we're going to do it a little bit differently, because I don't want to give the definitions at the same time and give the answer. So we'll just kind of go through all the answer choices. Is it negative punishment? Again, you have to know what negative punishment is. Is it shaping, or is it modeling? Again, a lot of times for unit 1 questions, human behavior, human development, it's mainly a content-based section or unit. So you have to kind of understand the definitions of things in order to be able to apply them into scenarios. So for this one, you would have to know what each of these answer choices were, or at least the correct one, to be able to compare it with what the priority is and what the question is asking you, based on the type of interventions the social worker is proposing. Okay, So first we can start by eliminating any of these that we know is not the correct answer. So that would include choices that you know the definition of, that you know is not related to what this question is asking. So in this case, looking at shaping, I know that shaping is primarily about reinforcement. And so we don't want to reinforce this little boy's behavior. So the teacher telling, the social worker telling the teacher to say, hey, have the students hit him back when he hits them, is not a sense of reinforcement, because shaping is a procedure in which the reinforcers are implied or applied in steps on a subject to get the subject, which is the little boy, progressively closer to exhibiting a target behavior. So we're not trying to reinforce a targeted behavior here. So I'm gonna eliminate shaping because that is just not relative here. Okay, and so modeling, we know, is also when someone is learning a behavior through observation, and that's without the therapist or whoever having to say anything or reinforce anything. They are just basically observing the behavior of the therapist, of the teacher, or whoever, and then doing that back. So it's all based on observing what is being presented. That is what modeling is. The therapist, in this case, the teacher would model the behavior, would basically show them, okay, how to respond, how to hit him back or whatever. She wouldn't have to say anything because it is not anything verbal. Modeling is all by observation, what the child sees. So that is irrelevant in here as well. So now we have aversion therapy and negative punishment. So in aversion therapy, it's kind of like you pair an unwanted behavior with a stimulus that you want. With the stimulus that you don't want. So you take an unwanted behavior and you pair that with an unwanted stimulus. Okay, and so the idea there is being that the desirability of the behavior will decrease. Okay, so again, aversion therapy is like you're just trying to avert the behavior, stop the behavior, change the behavior, turn the behavior around, right? So that means you're going to pair the unwanted behavior. So the unwanted behavior could be, you know, in this case, I don't know, pulling their hair, and you're going to pair it with an unwanted stimulus, like what is something that he probably doesn't want back, and then hopefully that will change or decrease his behavior. That's what aversion therapy is, which does kind of sound like what the social worker may be proposing. Also, negative punishment, we know, is taking something good or desirable away to reduce the occurrence of a particular behavior. And if you are not clear on negative punishment, positive punishment, the reinforcements, I made a video specifically about that about a week ago, so be sure to check that out. And while we're at it, make sure y'all like, subscribe, and comment on this video. It really helps me to produce more content. So also, getting back to the negative punishment. So in this case, negative punishment, you have to take something that is good or desirable away. And so do we see anything in this situation being taken away based off of what the social worker is proposing? Actually, no, she's actually adding something, saying, okay, allow them students to do the same thing back to him. So she's not taking something away. So that tells me that it is not negative punishment. And y'all, I'm taking my time with this one because human behavior is an area on the exam that I'm realizing that a lot of my clients are struggling with. When they come to me and I look at the test scores, they are struggling with this area because it is definitely an issue of understanding the content. Okay, so aversion therapy, again, like I said, we're going to pair an unwanted behavior with an unwanted stimulus. So in this case, the unwanted behavior is the fact that he's pulling the little girl's hair and hitting on hitting the little boys in the back of the head. So when you add an unwanted stimulus like hitting him back or maybe pulling his shirt or something like that, that's something that he's not going to want. So that's an unwanted stimulus. And so that is probably going to stop him from doing what he's doing. So even though that probably sounds unconventional, the social worker's approach will be most similar to that of aversion therapy, because she's trying to basically avert that behavior or change that behavior. So the answer for this one would be aversion therapy. All right, unit 2, this is the assessment and diagnosis unit, where the questions are usually asking you to intervene on the basis of assessing a client's signs and symptoms, or diagnosing a client. So usually you are looking in these scenarios for primarily signs and symptoms, but also if they state a frequency and or duration of these symptoms, that is very helpful to answering the unit 2 questions as well as identifying them. Okay, so let's get into it. A social worker completes an initial assessment of a client suffering from anorexia nervosa with significant weight loss over the past month. In order to best meet the client's immediate needs, what should the social worker do next? Okay, so it tells me that I am completing an initial assessment, so that lets me know I'm in the beginning phases of the helping process with this client. So my presenting problem is that this client is suffering from anorexia nervosa, because that's why the client is there, and then the client also has significant weight loss over the past month. So that is all a part of the presenting problem, but I am going to highlight this part as my priority because I'm seeing this client because he or she is suffering from anorexia. However, it says that this client also has significant weight loss over the past month. So that gives me a time frame, and it's saying it's significant. So we definitely want to pay attention to this as a priority. So the question is asking me in order to best meet the client's needs. So of course, whenever it asks me to best meet the client's need, I like to pay attention to the word best, because that specifically tells me I need to meet the client where they are in their situation. And so in this situation, it tells me that my client is suffering from anorexia, but over the past month she's lost a lot of weight. So I'm going to go right there in that situation, and it's asking me what should I do next. So usually when you have a next question, you're looking for the last thing that the social worker already did, if anything. In this case, the only thing that she's done was she's completed an assessment. So I know that after I complete an assessment, then I'm going to move on to the planning stage, because I've gathered the information about the client's priority issue. Now it's time to plan a way to address it. So in this phase, we're identifying what the client needs to address the issue, and ways to go about meeting those needs, right? That's the phase we're going into, the planning phase. So that lets me know next I am going to be looking for something that is done within the planning stage, because I've already completed the initial assessment. It's asking me in order to best meet the client's immediate need. What is the client's immediate need? Okay, she is suffering from anorexia with significant weight loss over the past month. So there's a need in there somewhere within the priority issue. So would the next thing I do be to contact a dietitian who can suggest proper weight gaining supplements for the client to take? Would that be the next thing I do for a client who has been losing significant weight loss over the past month and they're already suffering with anorexia? Contact the dietitian. Possibly. So we're going to pause that. Also, I want to point out with these Unit 2 questions, if you notice, it's giving you certain symptoms, signs and symptoms of either mental or physical ailments or disorders. And so that's how we're going to identify that this is a Unit 2 question. Unit 3 questions usually gives us signs of a situation, but this gives us, Unit 2 gives us signs of, symptoms of an illness or a disorder or something like that, okay, mentally or physically. So we're going to pause A. So with the next thing we do about this client that has significant weight loss over the past month be to encourage her to attend a support group. Well, that is definitely not going to address her significant weight loss over the past month, so we're going to eliminate that out the gate. C, consult a doctor about potential hospitalization. That could address the significant weight loss over the past month. She's already suffering from anorexia, so that might be something we do as well. What about D? Refer the client to a registered dietitian, which this should have an A right there, who can teach the client healthy eating habits. Referring the client to a registered dietitian, to me, it's kind of the same as contacting a dietitian who can suggest proper weight gaining supplements. This one is saying, refer her to a dietitian who can teach her healthy eating habits. So there is a difference. This one is, her getting suggestions on proper weight gaining supplements. This one is her being taught how to, who can teach her how to eat healthy, right? So is this going to address her significant weight loss over the past month? It possibly can, teaching her healthy eating habits, but not immediately. So I'm definitely going to eliminate that, because this is a big deal. So we want something that's going to directly address that. So in the same with A, contacting the dietitian who can suggest proper weight gaining supplements is still not going to address the significant weight loss that has already happened, right? So we know she is already suffering from anorexia and she's lost more weight over the past month. That is an extreme physical safety issue, and so because of that, we know we want to prioritize safety. So we're definitely going to consult a doctor about potential hospitalization in this case. Given the severity of the weight loss over the past month, it is imperative that a consultation with a physician occurs to address the client's immediate needs. Her immediate needs is she losing all this weight, and we know that that is a danger zone, okay? So while contacting, the dietitian and, the support groups and all of that may be helpful, a medical consultation is the best response for the social worker to do next in order to meet this client's immediate needs. Okay, Savvy Social Workers, so now let's get into a Unit 3 question, which of course you know that this is the clinical interventions, case management type questions that you are normally going to use the Savvy strategy to break down, all right? So a social worker is working with a client who recently lost her mother due to breast cancer and is having extreme difficulty finding ways to cope with the trauma and grief. After validating the client's feelings, what should the social worker do next? So the social worker is working with the client, so that lets me know we're in the implementation phase of the helping process, our active work with the client. So we've already started working with them, so we're in the middle phase, right? And so the client recently lost her mother due to breast cancer. That's a part of the presenting problem, and we want to pay attention to the time frame, which is recently, so we know that this is something that just happened, and is having a hard, is having extreme difficulty finding ways to cope with the trauma and grief. So this is an example where the presenting problem and the priority problem is one and the same, usually when it's only 2 sentences, and it's an intervention question. The presenting and the priority will be in the same sentence, okay? So she recently lost her mother due to breast cancer, but her main issue is that she's having extreme difficulty finding ways to cope with it, right? So this is the next question, and so that means we want to check and see what the social worker already did, if anything. And so the last thing that the social worker has done was validated the client's feelings. So we know that after we validate the client's feelings, what do we do next? So that means we've already, kind of let her know, understand how you feeling, or I'm sorry you're feeling this way, those type of things. So what would you do next that will address the fact that she's having extreme difficulty finding ways to cope with this? Because remember, the answer we pick has to directly address the priority problem that we highlighted in red. Okay, so would the next thing be to share a personal example of how she copes with the same issue? Definitely don't want to do that. That's not going to help her cope by telling her your story. Teach her healthy coping skills. Possibly. We validated her feelings. We're in the middle phase, so possibly. We'll pause that one. Explore the dynamics of her relationship with her mother. Is exploring the dynamics going to address the fact that she's having an extreme difficulty finding ways to cope with the trauma and grief? It is not. So we're not going to do that next. Again, that might be something we can do within the process where we're looking for the next thing to do after we validate the client's feelings that is going to address her priority issue of coping with the trauma and grief. So will we next suggest that she join a grief support group? Again, that is something that we definitely could do, but we don't want to do that next right after validating her feelings. Like, hey, I'm so sorry you feel this way. How about you go join a grief support group? As a social worker, we serve in the helping capacity, so we want to make sure that whatever we do helps the priority issue. And so the best answer for that would be to teach her healthy coping skills that will directly address her priority issue, because she is finding it difficult to cope. So teaching her healthy coping skills would come next after validating her feelings, since the social worker is currently in the intervention stage of the helping process. We're currently already working with her, right? We're in that middle phase. Teaching her these healthy coping skills would be what we definitely would do next. Like I said, sharing a personal example is not warranted at this time. Exploring the dynamics of the relationship with her mother does not address the priority issue of her finding ways to cope with her grief, and suggesting that grief support group could definitely be done later. Unit 4 question. A social worker supervisor notices that one of her interns is doing a great job at building rapport with her assigned clients. However, she has noticed that the intern has trouble formulating appropriate treatment goals and completing documentation on time. What should the supervisor do? Okay, so it doesn't say what should the supervisor do first or next or whatever. So it just says what should the supervisor do, which lets me know that this question is ethically based, and so I want to approach it with that mindset. So the issue here is that she noticed that the intern is having trouble formulating treatment goals and turning in her documentation on time. All right, so ethically, as a supervisor, what should you do? Praise the student for her strengths and provide assistance to the student for areas in which she needs improvement. Sounds like something a supervisor would do, so we'll pause it. Tell the student that in order to be a good social worker, she needs to excel in all areas. Definitely not gonna go with that one. Reinforce the written guidelines to the intern and have her go back over them. That is something that we could possibly do, but as a supervisor, we are there to kind of provide assistance. So just sending her back to the guidelines and, hey, go back and read this and learn it, that may not be the most ethical thing as a supervisor to do. Recommend a treatment planning and documentation course for the intern. This is also something that we could do, but again, considering our role as the social work supervisor, this is a part of our role. So kind of like sending her off would definitely not be the most ethical thing that we're going to do. So basically praising her for her strengths, giving her some positive reinforcement, and then providing her with the assistance on the areas that she's struggling with. That is the role of a supervisor. And, keep in mind, this is an intern. So the role of the supervisor is to guide and support the intern in her efforts to become a competent and well-rounded social worker, right? So the supervisor should acknowledge her strengths while providing her with concrete assistance to improve in the defined areas, right? So the supervisor definitely should attempt to help her herself before just trying to, put her off, rather than, referring her to go read something. The written guidelines may or may not be clear to the intern, so telling her to go back over them may suggest that the supervisor is not available for direct guidance and assistance, as she should be as a supervisor, especially of interns.